Yeah, so when you meet your gynecologist, as soon as you test positive, roughly around 6 to 7 weeks of pregnancy. This weeks of pregnancy is calculated from the first day of last period. So that is how we calculate, and the total duration of pregnancy is around 40 weeks. So this will be divided into 3 trimesters, that is 3 months each. So in the first visit, when you go to a doctor, this is the most important visit where the doctor will spend some time with you. We need to get your history basically. Are your periods regular? Because based on that we can give you an expected due date. So it starts with that. Then the doctor will confirm the pregnancy by asking either for an ultrasound or a urine repeat your pregnancy test. And then the ultrasound will tell us, is your pregnancy in the right place, that is in the uterus. Rarely women can have pregnancy in the wrong places like tubes and ovaries. So the first step is to establish where the pregnancy is and how many babies are there. Is it single, is it twins, and is there a heartbeat? So this important checkup will happen in the first visit. Having established that a woman is pregnant, early pregnant, then the doctor will take a detailed history of her medical history. Is she on any medications? Has she got any medical conditions like diabetes, epilepsy? So because there are certain medications that they should avoid in pregnancy because it affects the baby. So this, and any family history of illnesses, especially genetic disorders, because your baby can get this disorder again. So there are certain tests available to offer these women to pick up whether this baby has any of these problems. So this detailed history is very important, and to educate the woman at this visit as to what she should do, what she should expect through each month of her pregnancy, and what are the warning signs she should be looking for, like any bleeding, any pain, she should immediately report to the hospital. Then we will advise these prenatal vitamins, and then we will give a monthly checkup appointment for her to come back. And when she comes back, we give a list of routine tests that the woman should do, like urine test, blood group, because each one is important, and look out for any diabetes, because Asian women have the biggest risk of developing diabetes, and pregnancy is another risk factor. So if there are risk factors in that woman, we ask for diabetic test, thyroid, then hemoglobin. So all these routine tests we write for her, and then we offer prenatal genetic testing depending on their family history. Nowadays genetic testing is routinely available in the form of first trimester screening, that is at the end of 3 months there is a special scan, nuchal scan plus a blood test which will give a risk status for that baby. Is that baby at high risk of having a chromosome problem or low risk? So these are useful tests to establish safety of the baby. So all these will be discussed in the first visit, and then a planner will be given as to the future visits and how the pregnancy advances, how the baby is growing, how the baby has developed. And the most important advice we give at the first visit is that the baby's organs will all be formed in the first 3 months. So the woman should not be taking unnecessary medications. She should avoid, if at all possible, all medications, because there are certain groups that will affect the organogenesis, that is developmentally it can cause anomalies in the baby. So we advise women, do not take medications unless you consult a doctor. So this is one thing. And for common ailments like vomitings or headaches, certain safe medications, we will give them an advice. Other than that, if they need anything, they should consult a doctor. After 3 months, all the organs are developed, then the growth of the baby starts. So that's when we give them iron and calcium. So first 3 months we give folic acid and any medications for vomitings. After that we change to iron and calcium, which will help in the baby's growth. So this is a very important visit, if you ask me, and they should spend time. They should write down their doubts. We appreciate if patients actually come with a questionnaire, because it's easy for us to clear all their doubts and myths. So we usually allocate separate times for first time booking visits. It's called a booking visit to sort out all these, because we can then make a long term plan for that pregnancy.